I'm Kevin Sprague, Associate Dean of Admissions and Enrollment Management. I'm also a proud alumnus of Wayne, class of 1980. And Wayne has made me Warrior Strong, and I'm a member of 24,000 alumnus who also can claim the same Warrior Strong background. Now, let me introduce Dr. Karen Matzikos. She serves as the Executive Vice Dean for the School of Medicine, also an Associate Professor of Radiology. She is responsible for graduate medical education, continued medical education, enhanced clinical affiliations, leadership searches, and special projects. An outstanding educator, Dr. Matzikos joined the School of Medicine from Stony Brook University Renaissance School of Medicine in New York, where she served as an assistant professor in clinical radiology, vice chair of faculty and staffing administration, and associate director of the diagnostic radiology residency program. While she is new to our school, she has been a vital leader in launching many new exciting programs that we will share today. Dr. Matzikos.
Dr. Sprague, thank you so much for your kind words. And I'm so excited to have this opportunity to speak with all of you today. Thank you for tuning in. We're always happy to host and share about all the exciting things that we're doing here at Wayne State. I really want to focus on two important initiatives that we have developed and are launching and are very excited about. The first is the 3-year MD program. Basically, this is open to everyone who is potentially enrolling in the class of 2022. And this actually takes the 4-year MD program and kind of truncates a portion of it and allows people to graduate with an MD in 3 years. So there's some important features to this program. Obviously, it cuts the school time without sacrificing the education received. It reduces the amount of educational debt incurred because you actually are obtaining your degree in 3 years instead of 4. And one of the really exciting portions of this program is that applicants coming in have an eye to the residency that they would like to participate in. And then there is an understanding, like an affiliation between the student and the residency where there's mentoring over the 3 years. And we're offering this for all of our affiliated residencies, including anesthesia, radiology, pediatrics, orthopedic surgery, internal medicine, family medicine, obstetrics and gynecology, dermatology, otolaryngology, urology, pathology, medicine pediatrics, emergency medicine, and radiation oncology. One of the very exciting features of this program are all of those specialties that we offer. So the pre-clerkship period, which is ostensibly the first 2 years of medical school, you'll be enrolled in a potential 3-week clerkship preparatory course, and then there'll be additional mandated activities, including regular mentoring sessions that'll be led by the respective residency program faculty. During the clerkship, which is your 3rd and normally 4th years, you will enter in 4 weeks before the regular cohort, and you're required to complete all the clerkships that the students in the 4-year program are required to complete. So what that really means for those of you who are keeping score at home is the time that is truncated is the time for away electives and for interviews, because you've done that on the front end. So before you actually have come into medical school, you will have interviewed with a residency and you potentially will have partnered with that residency program. So the additional time required in 4th year for you to do additional electives, time rotations away to be able to match somewhere, as well as time to interview, is truncated because you've completed that at the front end. So the post-clerkship portion will consist of 3 months, 1 month for USMLE Step 2 study, 1 month for emergency medicine, and 1 month for a sub-internship. The overall curriculum time exceeds the LCME, or the Liaison Committee on Medical Education requirements, which is a minimum of 130 weeks. So we actually meet and exceed what the standards are in terms of the time for education. Another very exciting program that we're launching this year is the MD MBA program that's designed and co-taught by Wayne State University Mike Ilitch School of Business faculty, which includes a very high degree of integration and knowledge transfer. The MBA courses are taken concurrently during the 18-month pre-clerkship and 14-month post-clerkship phases of the MD program. So all of that integrates in together. So at the end of 4 years, you will graduate with an MD and an MBA. The curriculum provides core courses in both medicine and business, as well as supporting elective courses in each field. Specialized courses in medicine and business, opportunity for interdisciplinary coursework with students and with faculty in fields associated with healthcare, including nursing, pharmacy, public health, and biomedical engineering. Another very exciting feature of this program is because of our special arrangement with the Mike Ilitch School of Business, all of our medical students who have applied and have been accepted to Wayne State University School of Medicine do not have to apply additionally to be accepted into this program. So there's not additional GREs or any kind of graduate exams, and there's no additional applications. So we think that these are very innovative, cutting edge programs. We're very committed to leading in the forefront in a lot of this sort of changing landscape in medical education and how we approach preparing our physicians for the future. So next, I would like to take the opportunity to introduce Dr. Senthil Kumar Rajasekaran, who is the Senior Associate Dean for Curricular Affairs and Undergraduate Medical Education, as well as Dr. Chris Steffes, who's the Associate Dean for Clinical Education. Thank you so much for your time.
Thank you, Dr. Matsoukas. Appreciate it. Welcome, everyone. Hopefully, you're all as excited as we are to see you all on the call. And glad that so many of you chose to join us and learn more about our program. So I'll be walking through the curriculum that we have laid out for our students. So first, I'll start with the pre-clerkship curriculum. To give you a 5,000-foot view, our curriculum is divided into 3 phases: the pre-clerkship phase, the clerkship phase, and the post-clerkship phase. And the pre-clerkship phase, we have 2 segments, segment 1 and segment 2, that's approximately equal to first year and second year of medical school. We don't call it year because it's not 12 months. So the pre-clerkship curriculum is 18 months long, and the clerkship curriculum is 12 months long, and then the remaining 18 months is the post-clerkship curriculum. And we have a 2-pass curriculum, meaning you'll be learning the contents such as physiology, anatomy, microbiology, immunology, and of the normal organ systems in year 1 or segment 1, and then you'll transition into learning the same organ systems in the abnormal sense, meaning you'll be learning about the pathology, pathophysiology, and pharmacology of the same organ systems in the year 2. And a few unique things that you'll experience if you choose to and are accepted to our medical school is the longitudinal courses that you'll learn more about. We have the P4 course, the service learning, the clinical skills course that runs longitudinally across the whole segment 1 and 2, where you'll be gaining experiences longitudinally over a period of time. And then in a minute, I'll also talk about one of the few medical schools that have, we are one of the few medical schools that have longitudinal electives in the year 1 and year 2. And then also when you go to the year 2 curriculum, you will get, you'll be placed in actual clinics working with the physicians in the community, and you'll gain a longitudinal clinical experience that is also really unique for us. Not many medical schools are able to offer that because of various reasons. We are glad that we are able to offer this experience for our students. And then after completing your coursework by the December of your second year, you'll be placed in 6 weeks of USMLE Step 1 preparation. And then you'll also have 7 weeks of clinical discovery phase where you'll be orienting yourself to the clinical clerkship, which will be really exciting times. And then in the next slide, I'll talk about the electives and then hand it over to Dr. Steffes. As I mentioned, we are one of the very few schools that offer electives in the first and second year of medical school. And what that means is if you are a student who wants to do above and beyond, there are opportunities that we have built in for you while you are in the pre-clerkship phase of the curriculum. So you can elect, all students are required to apply for these electives. And then there is a review process. Your application gets accepted, then you'll be placed in an elective. And every student is allowed to take up to 2 electives in segment 1 and up to 2 electives in segment 2. The electives that we offer are medical research that includes basic science and clinical research. And we pair you with basic science, bench research, or clinical faculty who conduct clinical research. And then you'll be engaged in a longitudinal research project. And then there are electives in community engagement. This is above and beyond the service learning that you saw in the previous slide, where you'll be taking a project and working in a focus setting in a community and study the impact and then publish the results. And then we also have an elective in medical education. If you are a person who is interested in academia as your career aspirations, then this is a great opportunity for you. And then we also have a unique leadership and external affairs development or medical political action elective, through which you can really influence policies at the Lansing level, meaning you'll be working with a faculty who can provide you access to the lawmakers, the lobbyists who are in the business of making policies that will have a huge impact on healthcare and policies that impact the communities. The two new electives that we're offering, beginning one this year and beginning one next year, is the business of medicine elective. The picture you see here is a session where we invited a direct primary care provider and a private solo practitioner who shared about the models of delivery of care. So these are really cutting edge that Dr. Matsikas presented earlier that we are able to offer, and our students thoroughly enjoy these experiences. And then the last one is the continuous quality improvement elective that you'll be receiving beginning next year onwards. With that, go to the next slide. Yeah, with that, I will hand it over to Dr. Chris Teffes, who is our Associate Dean for Clinical Education.
All right. Thank you, Dr. Rajasekaran. I'm going to talk a little bit about the exciting part in my mind, which is the clinical education. In our highways curriculum, we start this early on in segment 1 and segment 2 with clinical skills. And then in the segment 2, going into the clinical experience clerkship, where you are in a outpatient ambulatory office learning the nuts and bolts of taking care of patients. That plus the pre-clerkship course that Dr. Rajasekaran mentioned, get you ready to start year 3 or segment 3, which actually starts in April. So we actually have 12 months of segment 3, but it goes April to the end of March. In this 12-month period, we have 4 blocks that are 12 weeks long. One of the blocks is surgery. And as part of surgery, in those 3 months, you participate in 2 weeks of anesthesia and also into surgical subspecialties. There is a 3-month block of internal medicine, which is really the core of learning. And in that 12-week block, there are 4 weeks of outpatient medicine, ambulatory medicine included with the inpatient medicine. There is a 3rd block, which consists of 4-week rotations, 1 in neurology, 1 in psychiatry, and 1 in family medicine. Family medicine, of course, is all outpatient. The other 2 are mostly inpatient. And finally, the 4th block is 6 weeks of pediatrics, which is partly outpatient, and that is combined with 6 weeks of obstetrics and gynecology. So overall, there are 7 departments that you rotate through, but this includes ambulatory and inpatient, and also some subspecialties along the way. As part of segment 3, we also have a longitudinal course. This is a continuation of our 4-year course of clinical excellence, and it's called the CRISP course, Clinical Reasoning Integration Skills for Practice. And this meets every 6 weeks or every month, and we have teach skills that are common to all the clerkships, and everybody participates in this. So after we're done with the year 3 and the clerkships on April 1st, we start 4th year. This is an advantage because you are 3 months ahead of a lot of medical schools in this country and can start into your specialty rotations, audition rotations, and discovery rotations. A lot of students get through 3rd year and still don't know exactly what they want to go into. So we have extra time based on this extra 3 months to figure that out. You can, all the rotations are 1 month long. And they include some requirements. There's a required rotation in emergency medicine. There's a required sub-internship. And we also have a couple of unique things. We have a month of residency prep right before you start your internship. We also have a month-long course in medical education where you are involved throughout the year, throughout segment 4, in teaching the first and second year clinical skills courses after having been given a foundation in learning principles. And we're also starting a longitudinal course for segment 4. So lots to do in segment 4, but we have extra months to do it, which is a great opportunity to discover what you want to go into if you don't quite know yet. Really build your portfolio and become a very effective physician and resident when you finish school. And with that, I'm turning it over to Erica Roberts, who is our manager in academic student programs.
Thank you, Dr. Steffies. It's great to see so many of you on the call, and Wayne State is a school that is near and dear to me. I graduated with my bachelor and master's degree from Wayne State University and have worked at the School of Medicine for the past 5 years within the curriculum office. And I'm excited to share a couple of programs that we have for students as you're going through the curriculum that was just presented to you. We have some programs that allow us to highlight students who are really going above and beyond. So our first program that I'm going to share with you is the Difference Makers program. So alongside with your course evaluation process with each 12-week course block that was just presented, you'll have the opportunity to evaluate your course and instructors. And also alongside with that, you'll have an opportunity to nominate students, faculty, and staff members who have made a positive impact on your learning during that course block. And so we feature the top nominees across the School of Medicine platforms. I'll reward them with this beautiful ornate certificate. You can see one of our students here proudly presenting and smiling under the mask, I'm sure of it. And then another program that we have that students can really stand out as far as the reward system works. The top reward for this program is denotion in the MSPE letter about excellence and professionalism. So PEARL stands for professional, empathetic, excuse me, accountable, respectful, leadership, and stewardship. And so this is an excellent in professionalism program. And so faculty, staff, residents can nominate students who they believe have, went above and beyond the standard professionalism for medical students. And we are able to showcase those students, and they're able to earn rewards along the way as they get submissions from different faculty and staff and residents. So just wanted to share with you some unique programs that we have going on to highlight students while they're working through the curriculum. And now I'm going to pass it off to Dr. Josh Collins, who is the medical director for the Cato Clinical Skills Center, and Dr. Erin Miller, who is the course director for the Segment 1 Clinical Skills course.
Thank you, Erica. Appreciate it. And welcome to all of our participants and attendees today. So thank you for giving us your time tonight and coming to hear about this wonderful school. As mentioned, I am Josh Collins, the medical director for the Cato Clinical Skills Center, and I am also a proud graduate of the class of 2010. Warrior strong ever since and during that time. So I've been involved in medical student education ever since that time, even during my time in residency in Metro Detroit. And every moment of my career has been spent focused primarily on medical student clinical education. In the role of as the medical director for the Cato Clinical Skills Center, we really get to focus on a few things, which you'll see here in this slide. And we recognize that Wayne State University School of Medicine is a very unique medical school in the country. We are a very large program, and we are very much inclusive of all backgrounds and individual domains. And so we recognize that in our own internal mission within the Cato Clinical Skills Center, which we recognize that students entering into this unique, call it like a professional identity formation lab or professionalism lab, where this is really where you get your first taste of learning what it's like to be a physician. So we recognize that many of you may have had prior experiences. Some of you might be second career people. Some of you might be straight from undergrad and never had any other experiences. And so we are inclusive of all of those backgrounds, and we have space for you to gain skill and develop your competence, which you'll hear about at a lot of other schools. But the way in which we do that at Wayne State, and particularly in our unit, affords the opportunity for you to grow at your own pace with wonderful and amazing formative feedback, and to advance who you are as a physician prior to entering into clinics during your M2 segment, and then also into the clerkships beginning in the M3 segment, as Dr. Steffes had mentioned. And so we recognize that that's where you're going to be. We want to set you up for ultimate success at each one of those steps. So I'll hand it off to Dr. Erin Miller, who is the course director, to give you a little bit more detail as to how we do some of that.
Hi, everyone. I'm Dr. Erin Miller. I'm the course director for the Segment 1 Clinical Skills course. I am another proud Wayne graduate. I graduated in 2013. I did my residency in the combined internal medicine and pediatrics residency here, and now they can't get rid of me. So I have the pleasure of working in the pre-clerkship clinical curriculum. And so over the first 2 segments of your education, we really make it a point to keep the focus on patient care. So even while you're going through basic sciences, you'll always kind of have a taste of why you came to medical school and how you're going to interact with patients going forward. So in segment 1, you'll take clinical skills where you'll come to our simulation center 10 times over the course of your first segment and interact with standardized patients with the goal of kind of laying a very strong foundation for your future practice, and also helping to equip you with the skills you'll need to engage in the other aspects of the preclinical curriculum. So you'll be ready to participate fully in service learning opportunities out in the community, and you'll also get a sense of what it means to actually move about a clinic as a physician, so that you can kind of take that experience back with you to the P4 course that you'll learn about in just a few moments. And then finally, you're also getting instruction that's really helping you to appreciate the clinical aspects of what you're learning in basic science. So while you're in the anatomy lab dissecting the arm, you're seeing a patient in the skills lab with wrist pain. And so we do that very intentionally to make sure that you're really seeing the relevance of the basic sciences from day 1. And then when you move into segment 2, not only are you still coming to the skills center, still engaging with the P4 course, you're also now out in the community seeing real patients with preceptors. I have 4 students every year in my clinic as a preceptor. And so you're getting to put all of your, early experience to the test and in real life encounters. And so the Clinical Skills 2 course is designed to really prepare you for clerkship by giving you a sense of what you're going to need to be able to do in each clerkship, so that when you set foot on the wards from day 1, you're ready to really learn the medicine and to excel in that capacity. So it's a really wonderful program that prepares you for your 3rd and 4th year, I think, like no other program can, by really keeping the focus on how everything is very clinically relevant from day 1. So with that, I'm going to hand it over to Dr. Riddle Jones to talk a little bit more about service learning.
Hi, my name is Dawn Yargeau, and Dr. Riddle Jones has not been able to attend yet. We're hoping she'll jump on shortly. Service learning is meant to complement the mission of the School of Medicine. It's a local investment in the Detroit community. Future physicians care for medical and emotional needs of diverse patient populations. All of our students are required to complete 35 hours of service learning with local agencies and student-run clinics. And you can see the path that lots of the activities that we're involved with happen to be part of the service learning curriculum. So the community impacts during the pandemic The class of 2023 resource guides and virtual interprofessional home visits. 65% African American and 35% Latino families were visited virtually during the pandemic. Resource guides were created with pharmacy, occupational therapy, nursing, physician assistant students. Teams of medical students conducted interprofessional Zoom visits. This is just part of what the class of 2023 did. The class of 2024, they had community agency projects. With the community agencies, they addressed the needs of 80% Arabic and 20% Spanish-speaking families. 80% African Americans and 20% from other ethnic groups were trained in using Zoom, YouTube, Facebook, in order to get them more involved, not only in the community, but to help with telehealth visits and that type of thing. And that was just, a very small portion of how we impacted the community during the pandemic. I would now like to introduce Dr. Paul Walker. Dr. Walker is a professor in ophthalmology, visual and anatomical sciences. He is the director of our gross anatomy. He's co-director of Human Body Foundations 1 and 3. Dr. Walker.
Thank you. Welcome, everybody. I'm glad you could join us tonight. I'm here to talk a little bit about the gross anatomy program and tell you a little bit about how it is integrated across the M1 curriculum. As a matter of fact, I'm still in the gross labs now. We just finished the dissection of the kidney. And our dissection process is a full cadaver dissection program, and that sets us apart from a lot of other institutions who rely on partial dissections or no dissection. We train our students completely. They are fully engaged. We have a considerable number of small group active learning sessions, and gross anatomy is all part of that. Dissection occurs across the entire M1 curriculum, which is, in terms of the foundational coursework, it's divided into 3 main courses. And gross anatomy is a regionally based dissection program, but it is integrated into a systems-based curriculum. And so we are always talking across disciplines to physiology, pharmacology, histology, et cetera, in terms of helping students understand all disciplines and how it's related to how the body is put together. So what you see here on the slide is a group of students surrounding a cadaver that they are actively engaged in dissection. And we do dissection a bit differently than other institutes. We have something called dissection handoff, in which half the team will do the dissection and they will follow the instructions on a lab chart, which is similar to a patient chart in that it has tasks on the chart that they have to complete. And then when the dissection is finished, the other half of their team come in to the labs and they perform something called a dissection handoff, which is similar to the communication that would take place in a real patient handoff, although we're discussing the anatomy of the cadaver. So you're looking at a group of students that are going through their handoff right now, as half of the team was not present during the discussion or the dissection, but they need to learn the structures from the other half of the team. And this is true peer-to-peer teaching and learning. And then the next time, the other set of students who didn't dissect will dissect the next time, and then the same procedure occurs. So we also do something exciting in that we integrate medical imaging into our curriculum, and we collaborate with radiologists in doing so. And we also have a very unique ultrasound training program. When you get finished with ultrasound training, you'll know more ultrasound techniques than most residents, even senior residents. And this is something that sets us apart as well. In addition to the faculty that are engaging students in our small group sessions, we also have senior level medical students that are your senior classmates that come back down into the labs and assist the faculty in engaging student teams in Q&A sessions and clinical correlations and that type of active learning. And this all is designed to encourage your professional development as a physician in training. There's nothing better than being able to learn how to accurately and effectively communicate information about a patient. And you'll learn that in day one in our curriculum. So that's all I have to say about gross anatomy. And I could go to the next slide and pass the baton to Dr. Andrew Markovich, who is the co-director of the P4 course.
Thank you very much, Dr. Walker. I'm Dr. Markowitz. I'm actually the director for the segment 1 P4 course, Population, Patient, Physician, and Professionalism. So back when I graduated from Wayne State in 1985, when we were learning about social history, we essentially just asked if somebody smoked or drank or used drugs. Now we realize the importance of the social determinants of health, where you're born, where you live, where you eat, where you work, where you play, where you age. All of these factors are so important in a patient's long-term health outcomes. And what P4 does in this longitudinal course is give you the opportunity to learn, practice, and apply knowledge and skills as a physician in training in our diverse urban clinical and community outreach settings. The way we do this is in small groups with self-directed learning being emphasized. And as you see here, it says there are faculty facilitators. They're not lecturers. The goal is for the students to come in prepared and be able to discuss a lot of these topics. So what are we going to learn about in P4? We're going to learn all about these social determinants and how they impact a patient's health. We're going to examine strategies to identify and address structural racism, physician bias, learn how chronic stress can affect the long-term health, and importantly, advocate more effectively for the health of our patients and populations, including those who are from vulnerable and marginalized communities. We need to learn to identify where these health disparities occur for our underserved and minority populations. Another important part of P4 is the communication aspect. We need to learn effective communication techniques like empathetic listening and motivational interviewing, and learn again how to advocate more effectively for the health of our patients and our populations. We are going to work on these aspects at 3 levels, what we call a micro, meso, and macro level, which is at the individual, community, and policy level to implement changes to try and reduce the health disparities that these populations face. We look at the vulnerabilities faced by certain populations, including minors, the elderly, the LGBTQ plus population, and patients impacted by language barriers. This is a unique course. Many medical schools are still focusing on their 2 years of basic sciences and 2 years of clinical skills. So this is a novel course that a lot of medical schools don't offer. And these are extremely important skills that are going to impact every patient encounter that you have. We want you to develop skills to obtain and transmit information from patients during traumatic or sensitive clinical encounters as part of your commitment to professionalism and practice. We're going to help you develop your professional identity. And the topics in this course are continually being examined and changed as we identify new areas. For example, next year, I'm looking at creating a more advanced unit on bioethics and difficult bioethical scenarios. Another new unit will probably look at the illness experience of patient and families so we can discuss disease and how it affects patients, how it affects the caregivers, and how it affects the physicians. So with that, I'm going to turn it over to Dr. Dunbar. Thank you very much.
Thank you, Dr. Markowitz. This gives me an opportunity to talk about something that is extremely important to medical students, and that is that having our students participate in research and what we also call the scholarly concentrations. Medicine is essentially a career where lifelong learning is important, as well as developing new ideas of how to make things better and how to move things forward in the health industry. So many of you participated in some research while in college. However, our scholarly concentration and research will allow you to further develop not only your academic skills, but also give you an opportunity to explore some of the things that you're interested in. And by doing this, you can cultivate habits that are essential for developing a research program and also inquiry into any area. One of the unique features of our scholarly concentration is that the students and the projects they work on are individualized. It is not just something that is handed to you, but it's individualized where you work on projects that you're interested in that motivates you. And in addition to being able to determine your project, you will work on these projects with an engaged mentor. And the mentored research in the scholarly concentration is a very important feature, because working with a mentor helps you to develop skills, help in your capacity for creative thinking, and allow you to become very efficient in the area that you've decided. Another feature of our scholarly concentration, unlike many programs, is that this is a longitudinal program that parallels the entire curriculum. In other words, you can participate in a scholarly concentration throughout your medical career. And the reason why this is important, because it gives you an opportunity not only to participate, but to actually get something done where you can have something to show for the things that you've done. So we believe that the scholarly concentration and research would help you optimize not only the other information that you're getting in your classes, but it helps you to individualize your experiences, to explore various subjects, and in many ways can help you determine what you would like to do for your future career. And in doing this, the scholarly concentration gives you an opportunity to become really proficient in an area where you have an in-depth knowledge in that area. Now, we offer the scholarly concentration in a variety in different areas. We have the traditional basic sciences, and many of you have done some basic science research where it's usually can be referred to as the classic bench research, and many of the students want to continue some of the things that they've started while in their college or other careers. We have opportunities in the clinical sciences where students participate in clinical studies. And this is very important, especially in helping some of the students decide on different pathways and careers and things that they may want to do in the future. And Wayne State is also one of the few universities with an NIH program outside of the Washington, the perinatal research branch. So we have a really robust program in women's health, and many of the students can utilize this pathway to study women's health issues. And this is something that is also very significant in Detroit, especially as it relates to things such as premature births and things of that nature. We have, as you've heard, our Wayne State is heavily engaged in the community. And some of the scholarly work that we want to allow students to do are associated with public health and various community engagement projects. For example, in this recent last couple of years with COVID and how it impacts the community, we have students doing some research and scholarly work and trying to understand some of the issues of the disparate impact of some of these activities in the community. Another area is medical education. Many students want to improve the presentations and the organization of medical education, and they have an opportunity to look at this from a scholarly perspective, because this may end up being a career-long occupation. We have opportunities in global health, which students may want to travel to different areas of the country and different other countries to evaluate their health issues. And lastly, Detroit is and because of it, many of the environmental issues, we offer students an opportunity to participate in environmental health studies as well. Now, I would like to again stress the fact that this work that you do in the scholarly areas will be directed by a mentor. And why is this important? Because a mentor in this role will help the student to develop a realistic approach to developing an idea, how to proceed into structuring a program where they can have some realistic work accomplished. The mentor also helps the student to become a part of a research team. One of the things that is very important in research and health these days, and nobody does anything by themselves. Almost all of the work that is significant is done by a team, and a mentor usually incorporates the medical students with their research team or with other medical students to form a team to be able to get something done. And they learn how to work as a team to solve problems and move the information forward. The mentor will be able to work regularly with the students and give them feedback on their progress. And very importantly, almost all of the scholarly work requires some type of resources. And so the mentor can help the student in providing those resources. However, the Office of Medical Student Research will also provide students with resources to complete their work. And this community then provides the overall guidance for the student to be able to complete their work and have something importantly to show for it when they finish. Because in a scholarly work, one of the most important ingredients of that scholarly work is to have some type of publication or something that you can definitively say that you have done and what you've accomplished. If it's never presented, then you need, no one will know about it. So that's why a mentor helps in doing this. And lastly, but mostly important, the mentor will assist the student in their professional development, help the students where they're introduced into their professional communities, and also provide a source of recommendations of support and guidance as they move forward in their career. So our scholarly concentration and research, we feel, is a very, very important role that the students can participate in while they are in medical school, and it can fill in the areas and help the students have a really rounded educational process. And with this, I would like the next person, Dr. Chadwell, and she's the Associate Dean for Student Affairs and Development. Dr. Chadwell.
Thank you, Dr. Dunbar. Appreciate the introduction. And I'm also a proud alum of the medical school here at Wayne State University School of Medicine of 1994. So that might seem like a long time ago for you. And I remember being in your shoes and thinking, how in the world will I get from the outside to the inside of a school like this. And I can tell you it's a great journey, and I just encourage you to really look at everything that's been talked about here today, because it's an exciting pathway. So there's a lot here that you've heard about already, and you can have all the great programming and academics and everything else, but if the school has no heart, then you really probably won't thrive. And so really the Office of Student Affairs, we kind of say on our highway to excellence that all roads lead to student affairs. And we have a great staff here that really cares about students. So really any issues that you have on your journey through the highway to excellence, we help you with, and we try to provide resources for you to be successful and have a really great experience. That's really our bottom line, is to serve you, the students. And so a few of those things that we do to accomplish that are creating a culture of wellness. And one thing that's unique about that here at Wayne State is that there's a lot of talk about wellness out there, a lot of health and wellness initiatives and things like that at other schools, but a lot of them are self-selected. And one of our core tenets is that we really want you to create a self-care model to be an effective physician of the future. And so for that, we have actually integrated our health and wellness initiatives right into our curriculum. So you will get regular opportunities to develop self-care tools that can help you, just not just as a medical student, but later in throughout your career. That's very important to us. And we know medical school is tough, and so you need to really have some of those outlets and engagement, and being engaged with each other, with the community, with our administration is really super important. And you might think that Wayne State was such a huge school, and it is. We are the big kids on the block here, the big school on the block, but we do get to know you. We get to know our students, and we make it a priority to do that. One way we do that is through our counseling team in student affairs. We have one class counselor for each class of 300. And we really do provide individualized attention and care to what your particular issues might be, to help you navigate what can be a very complex journey through medical school. We have lots of different services that we want to help you get access to. And really, most importantly, we want to make sure that you're developing as a person. You've heard a lot about professional development, professional identity formation throughout this talk. And what we really try to do is take that one little step further, and is really to incorporate that into your total development as a person, because that's really important to us. When you cross that line, when I get to say your name on commencement, during that ceremony, it's really meaningful. I could tell a story about almost every student that crosses that stage, and it's very meaningful that way. So I want to tell you a little bit of more specific things that might interest you that we encompass in the Office of Student Affairs. There's a lot of student life here. So besides all of the academics and the scholarly concentrations and research and P4 and all the wonderful things you've already heard about that you will get, you can also choose to get involved in many different things. So we have over 70 student organizations, and they are very active in the community and with each other. And so that's a really wonderful outlet. Those include interest groups in just about every specialty that you can think of, and mentoring programs and all different things that are of your choosing. And so you'll hear a lot more about that if you come here to Wayne State. And major events are a big part of what we do in student affairs, because we really believe that those major events are mile markers for you. Again, on our highways to excellence, those are really important mile markers. So when you come in, your orientation, the white coat ceremonies, we have a really wonderful ethnic fair. We celebrate our diversity that way. We have match day and commencement. And so with COVID, we've had to make a lot of adjustments that way. And we have a little bit of catching up to do on some of these ceremonies because of not being able to hold some of them. But they are super important to us, and we put a lot of effort into making those very special, not just for you, but for your family to celebrate with you. I talked about counseling a little bit already, and health and wellness. Career advising is super important to us, because we want you not just to succeed in medical school, but to transition really successfully to residency programs. So we have many, many specialties that our students will match into. And this year we had our very historic and outstanding match of 99%. which is very significant. And that means most of our students, just about 100%, segued into a specialty of their choosing very successfully. And that's quite a feat to pull off with a school and a class this size. So our job at Student Affairs is to prepare you for that process. So the residency preparation process is very intense. In the last year, where we take you through, how do you, go through an electronic residency application service? How do you take all of those experience and capture them? Our office, myself in particular, and several letter writers we sit with you, we write the dean's letter for you, and that goes into your application. So that's a really important part, to capture all of the things that you may have been involved with and highlight you as a candidate to potential programs. And our seniors are out there right now interviewing actively. And then it all culminates in the match. And so the match happens in March of your senior year, and that's when you find out where you will continue your medical education in the specialty of your choosing. So there's a lot that happens in our office. We have a really great team here. And I just want to encourage you to stay the course with your applications, and hope to welcome you here soon.
So I was at a medical meeting yesterday, my first one in a long time. And I got into my car, and you're a dean of medicine when you think your car smells like formaldehyde. Wherever you go, you smell formaldehyde. And Dr. Walker was correctly talking about how good the anatomy course is. And when I first came here and they told me about it, I thought that kind of personified Wayne State School of Medicine. And what makes it different than other schools of medicine. Wayne State is a school where you roll up your sleeves and you learn how to be a doctor. And I think the sine qua non of that is anatomy. We have I would say, the best anatomy course in the country. And you learn anatomy by doing anatomy, by dissecting, not by having prosections. By having a large anatomy lab with plenty of cadavers. And that also brings to mind the second part of Wayne State that's different. And it's our sense of mission. There are many ways to become a doctor, and there are many ways to become a good doctor. And I'm not saying Wayne makes you a better doctor, although I do think that that's true. But what I am saying is Wayne makes you a different doctor. Wayne makes you a doctor who cares about the community. Wayne makes you a doctor who wakes up every morning and knows that he or she is doing righteous work. Wayne makes you a doctor that other doctors admire. One of my favorite statistics is we've surveyed residency program directors who aren't affiliated with Wayne State, but have had Wayne State medical students in their residency. And 70% of them said they would take a Wayne medical student sight unseen into their residency, because they know at the end of our medical school, our students know how to be great doctors. But I want to talk a little bit about that sense of mission and going back to anatomy. There's one very unique thing about the anatomy department here, that not only is the anatomy course an exceptional course, but the citizens of Detroit donate their bodies to the anatomy course. We have one of the largest and oldest organ donation and body donation programs in the country. So these are people who are your neighbors, who have decided that they want to make better doctors and have given their final gift to you to allow you to serve their community in the future. So anatomy to me personifies what makes Wayne State special. That you learn by doing, that you're a doctor who knows how to treat patients, from seeing patients and from talking to patients and from operating on patients, and not from reading a book about patients. And that there's this bi-directional sense of mission. that we have a mission to the community that we live in. And that community is so aware of that mission, and that mission is so important to them that they give of themselves to allow you to be a better doctor. Now, I'll say something that's somewhat controversial, but I believe it in my heart, that if you don't believe in our mission, if you don't believe it's important to take care of those patients who are underprivileged, who society has done a raw deal for, we're not the school for you. If you want to take care of the 1%, if you want to take care of patients who live on Park Avenue, we're not the school for you. But if you want to learn to take care of society and to be a future leader of society, this is the school for you. And I couldn't be prouder to be the dean of the school. So I appreciate your interest in our school. I'll tell you that you'll get an education second to none. But beyond that, you'll get an education in life second to none. And that's the gift that our patients give you. And that's the gift that our school gives you. So thank you for your time.
Okay, good evening, everybody. I am Dr. Simone Brennan, and I am one of 2 learning skills specialists in the Office of Learning and Teaching. Okay, thank you. So I just want to give you a quick overview about the Office of Learning and Teaching. First and foremost, I want to tell you that we're pretty unique among United States medical schools in that we are situated directly within the School of Medicine, and we tailor all of our advice and all of our support directly to medical students. And that makes us very unique in that we're not spread so thin and trying to counsel a lot of students all over campus. So again, just to give you a little bit of an idea of what we do in the Office of Learning and Teaching, everything that we do is based on theories of adult learning, brain-based, research that's been done on how people learn and cognition, and then also the psychology of learning and teaching. We offer workshops. We offer one-on-one academic support. We offer definitely an opportunity for students to work with faculty and to engage with faculty in active learning opportunities. And we support, most importantly, perhaps, although I don't think so, very importantly, is support for the USMLE Step 1 and Step 2 preparation. If you don't know what those are yet, you might want to look them up. But all together and all combined, our program is really here for you. And it's sort of filling in some of those cracks of being a student and developing into a self-regulated or a self-directed learner. So just know that we are here for everybody, not just certain students, and we are here to support everybody. Oh, and one of the most important ways that we do that is through the Peer Learning Coach Program, which we are a vital part of. And those peer learning coaches offer a wide array of support for all of you beginning day 1 in medical school, all the way until you graduate from here. So really, really happy you guys decided to spend time with us tonight. And please, if you have any questions at all, I'll chat, but please email us at olt@med.wayne.edu. And now I'm going to turn it over to the Vice Dean for Diversity, Equity, and Inclusion, Dr. Donovan Roy.
Well, thank you very much. I just recently been hired as the Vice Dean of Diversity, Equity, and Inclusiveness at Wayne State University School of Medicine. I'm really excited to be here and really to be a part of this conversation, to really discuss the importance of diversity and inclusiveness at our medical school. The Office of Diversity and Inclusiveness plays an integral part in supporting the identity and experiences of the student body, faculty, and senior administrative staff. Our office is instrumental in addressing social justice, health equity, and health disparities and socially determined health in our medical school curriculum. We oversee the Diversity Advisory Committee, which comprise of administrators, faculties, and senior administrative staff, in addition to the executive board representative from various student organizations like the Black Medical Association, the Latino Medical School Student Association, the LGBT People in Medicine, and the Student Senate. So for over 50 years, this school has really supported diversity and inclusion, has supported through our medical school recruitment and retention efforts. The recruitment that we do in this office cultivates students' relationship through the development of pathways and service learning programs, outreach, and community engagement. The diverse talent that we recruit comes from attending local, regional, and national recruitment events. Retention is a sense of belonging, which is essential and vital to maintaining a diverse medical school. To foster a sense of belonging for students, faculty, and staff, program includes dialogue circles, which is led by trained facilitators that provides a safe space to discuss uncomfortable topics and share solutions that really moves our medical school forward. Diversity Speaker Series is a variety of speakers sharing professional and personal experiences centered around the importance of diversity, equity, and inclusion in our medical school. Topics range from essential elements of diverse groups of physicians and the impact of historical medical apartheid and how it has it impact our future medical school when it comes to monitoring health disparities. Moving to our next speaker is Jack Fomby. Dr. Fomby is the president of Medical Alumni and Association.
Thank you very much. It's very exciting to be here. So why should you care about the Alumni Association when you're just, applying to medical school? Well, if you go to a medical school that does not have a long history, that is fairly new, they don't have a lot of alumni. We have 24,000 alumni who are at your disposal to help you in so many different ways. Just to list a few, on the screen, you can see we do medical specialty lunches and webinars. So you can easily connect with physicians who are in specialties that you might be interested in, and we will sit down and talk to you and network with you and maybe introduce you to people and give you an opportunity to shadow with us. I mean, that's really unique compared to a school that hasn't been around that long. We have learning community dinners to make you feel more engaged, to make you feel more connected with your learning community. And we support activities, help our students travel. If you want to do an away rotation, or you want to, or you've got an interview and you need a place to stay, we've got alumni around the world who will be happy to host you and help you out. Dinner with a doc. We just got great responses from students who had an opportunity to go out for dinner with one of the alumni and have an intimate, great conversation over a great meal about whatever they wanted to talk about, whether it's the future of medicine, what kind of practice they want to be in, specialties, things like that. It's incredible. And obviously there's shadowing opportunities. And because we're all around the world with this pandemic, sometimes it's hard to get into rotations that are away. And with alumni from around the world, we could help you do that. Some of you may have participated in the Future Docs program. That's for children who might be interested. It might be their first exposure to medicine. And we have a whole day set up with alumni and students, showing kids, what healthcare is and what could be, and maybe it is starting an interest in them. These kids are from the community and they absolutely love it. And then, you're going to hear about the financial support we do for organizations, student organizations, and you're going to hear about the student organizations. So I don't want to take any of that away, but they're incredible. And you've got alumni who have done those things and engaged with the city and the community, and now they are mentoring, a lot of the students. The Alumni Association, as you're going to hear, does provide funding from more than 70 student organizations. Everywhere you turn, you're going to see us around, us there to help support your activities. we support milestones. So we support the white coat ceremony. Many of us give money to white coat donations. So you'll find a little card in your pocket when you get your white coat and with well wishes from an alumnus. We help support match day and commencement. So all along the way, you're going to find that we are there to support you. We provide some swag, which you're going to love. And there is almost nothing that we will not do for our students, including growing a mustache for Mustache November or Movember at the request of a student. So really think seriously about the school that you choose and whether or not the alumni are really engaged, because they are going to help you navigate, network, maybe, introduce your name for interviewing, because, sometimes it's hard to get around, and through our network, we can help you out. So I wish you the best. And like Dean Schweitzer said, this school is unique. Choose the school wisely, but I can tell you the Alumni Association component of it is incredible. So with that, I will turn it over to Myrna Kafarani. Thank you. Who's going to tell you about the great student opportunities.
Thank you, Dr. Folby. I love your mustache, by the way, very nice. So my name is Myrna. I am an M2 and I am the BSO president. BSO stands for the Board of Student Organizations. Dr. Schweitzer very eloquently and beautifully explained the mission. I like to think of student organizations as the mission in action. So there are a couple different buckets. Dr. Chadwell mentioned this, there's actually 77 active student organizations. So that doesn't just mean there's 77 noted, there's 77 active student organizations. That means they hold events, they hold volunteering, they're meeting on a regular basis. So the first one that's kind of the thing that makes Wayne Wayne is our clinical bucket. You can see here kind of the big namers. I myself, my favorite one is the Riverwalk blood pressure clinic that happens in the summer. So some who aren't native to Detroit, the Riverwalk is kind of a tradition where some of the elderly population will go get their steps in during the early morning on the Riverwalk. And Wayne State has been there for a couple of years now, measuring blood pressure and counseling on like food and dietary needs. I learned how to take blood pressures through this Riverwalk. Nowadays, I don't know if you guys have been in clinic, but nowadays blood pressure is pretty automatic. But I was learning on an analog blood pressure cuff. And during my M2 year, my clinical skills professor asked me to show him how to use the blood pressure cuff, and I was the only one that got to know how to do it. So I think that was pretty cool and pretty proud of myself. Other buckets are community. So there are a lot of ways to get involved with the community. There's Auntie Nays, which is actually a woman who works with the community themselves, and she relies on med students, Wayne State med students, to help her fulfill her goals. We also are pretty unique in that we have 2 urban farming initiatives. So you may not know this, but the Detroit is a food desert, and the Michigan Urban Farming and also a brand new organization called the Medical Student Garden. It makes crops and grows tomatoes and vegetables and things like that. And then they'll go and bring them to the churches around Detroit or the food pantries around Detroit, where they can actually go for free to the population. There was also a brief touching on the interest groups. So pretty much every specialty, subspecialty you can think of, we have an interest group for it. And what that entails is alumni or Detroit doctors will come and speak. I know the surgical interest group will hold, how do I say this? We'll hold practice suturing clinics. So you can learn in your M1, your M2 year, how to suture these little plastic, sometimes there's the banana, sometimes there's these little plastic things that they buy for you. But then you'll go into your clinic years knowing how to do that. We also have Senate. So here at Wayne State, something that's super unique is that the administration really cares about what students think. So Senate is the way that we advocate for our other peers. I'm going to let Jenna, our executive president, speak more about that, but it's one of the best things that I've ever joined in medical school. We also have professional groups. So the American Medical Association, I'm going to touch on that because I think that Wayne is known around this area, at least for our resolutions that we write. So the American Medical Association is kind of like the national governing body that like explains the attitudes that the states has about medical stuff. And this year in 2021, we had 23 student resolutions get passed and now are being used in the American Medical Association's books. So and Wayne is known on those floors for advocating. And these subjects can range from like HIV counseling to health disparities. So everything you're learning in P4 and you want to make a change, we have organizations where you can actually put that stuff into practice. There's also our favorite are the talent groups. So you'll see the ultrasounds. That's our a cappella group around campus. Just a way for students to find common interests and find your group of people and really showcase and remember that you're not just a med student. You also have different likes and dislikes, and all of those identities can be found in one of these student organizations. Thank you so much. I'm going to pass it on to our wonderful president, Jenna Carter.
Hi, everybody. Thanks, Myrna. So my name is Jenna. I am the president of our student senate here at Wayne State. So as everybody's mentioned before, we have a very large student body, which is actually a pretty amazing thing because everybody comes in with diverse experiences, but also diverse passions, which really kind of fuels the student organizations that Myrna was talking about previously. And part of that is student senate. So basically, we represent all students, and our job is to be a liaison between the student body and administration, also main campus, but our hospital affiliates, and also the community at large. And we really accomplish this. We meet pretty frequently and discuss things that are kind of coming up with our student body. So we really are your delegates in a lot of ways. If you have issues, you have concerns, you bring them to us, you come to Student Senate, and we'll talk about them and try to move forward on them. So each class has their own separate student senate where you can be a class representative. And also there are national positions such as the student rep there, so the OSR. And we come together, and then we have an executive student senate. And the also good thing about this, it's not on the slide, is that we also have, if you don't want to be just a student senate representative for your class, but maybe you have more specific interests, we have an external senate. And all of our external senate committees include things like the admissions committee, the curriculum committee, health and wellness, technology committee, professionalism, promotions, and also our institutional justice initiative coalition. So basically, we have representatives from a bunch of different communities, and we come together to represent students. We also put together a lot of kind of community or social events. So every year we host different events such as the ethnic fair. We also put together a gala for all 4 classes and host things like Halloween parties. In previous years, we've also put together kind of different like Med Cup challenges between all the different classes. So we kind of promote our community and student community specifically and try to improve that at the school. And I will also say that so I'm an MD PhD student, so this is going on my 5th year here. And there is no place that I would rather be than Wayne State. And it really is a community of students who care a lot, but also faculty members who also care a lot and support the students through this process. So it's really fun to kind of be a liaison between students and faculty in our community and get to kind of promote some of the best parts about Wayne State. Okay. So next I'm going to introduce Amanda. So Amanda is one of our M1 class reps, and she's going to tell you a little bit more about what's it like to be in M1.
Hi, everyone. So like Jenna said, my name is Amanda. I am an M1, and I'm just going to give a brief overview about like transitioning into M1 and sort of what it's like in Detroit, and all the cool opportunities you can have if you come, join our class. So in terms of transitioning, there's tons of support, but it is a large, big transition. So Once accepted, you're going to want to find a place to live. And there's a lot of opportunities to live in different areas depending on sort of what you're looking for. So the school is really centered in Midtown, around like where the DMC is. We're in Scott Hall, Masaryk Hall, and those kind of areas. And that's where you'll be spending the majority of your in-person time. But due to COVID right now, there's a lot of hybrid. So it's not too hard to get, around the city and stuff and be able to, go home for hybrid classes and this and that. Hopefully by the time you guys join us, there won't be so much hybrid and it'll be all in person, but we'll have to see how that goes. So if you want to, live closer to school, walk to school, it's probably best to live somewhere around Midtown. And there are tons of places to live in that area. That's where I live. I'm only like a 10-minute walk from school, and I love the walk to school. It's a great time to just kind of like relax and take a break from studying. If you want to be more downtown in the city, the riverfront is beautiful. It's right down a little bit past like the main area of downtown. And then you can also be up closer to the undergrad campus. I know a lot of my M1 friends like to study in the bigger student center, like to go to the gym up there. So sometimes students prefer to live up near the undergrad campus just because of the other buildings there. It's kind of up to you, but I really would recommend coming and seeing the city and kind of deciding, what area is best for you. And then I also have some friends who live in kind of the adjoining areas where you can kind of get a little bit more space for a little less money. You'll probably need a car if you're going to live more like in the Royal Oak, Ferndale, Grosse Pointe area. Those are all kind of suburbs around the city. That's probably like a 10-minute drive depending on how far out of the city you live. But those areas are all really nice. They have great downtowns as well that are lower key than in the big city of Detroit. So those cities are also great places to consider as well. In terms of activities, you're going to want to take a lot of breaks during M1. It's a lot of studying, a lot of schoolwork and working all day throughout the whole week. So on the weekends, I really recommend kind of taking a break, taking a breather, and going to do something around the city, especially if you're transitioning to this state or this area and you don't know very well. There's so much to do. So we have all the different sports teams. We have the Tigers, which are baseball. We have Detroit Red Wings, which is the hockey. We have the Lions, which is our football team. Hopefully they'll start doing better. And what am I forgetting? There's one more I'm forgetting, but I can't remember. Okay, well, that's embarrassing. Oh, the Pistons, basketball. So those are really fun to go see those games, kind of take a break. Sometimes the Senate will put together an event where we'll have all of us go to a game together, and that's always really fun to go with your other classmates. Then there's a bunch of like plays and ballets and stuff they put on in the theaters around and concerts around the city. So that's also a fun thing to do. If you're looking for something, there's great food in the city. There's tons of like Mexican food in Mexican Town. There's a ton of other varieties of food downtown and in Midtown. I was actually pleasantly surprised when I moved to Midtown because there's such great restaurants around the Midtown area, which I was kind of worried about because I know downtown is known for the good food. So that was really exciting to me. And then in terms of just like other activities, right now we have Campus Martius is in full swing with the tree and the ice skating, which is really fun. So that's like an outdoor activity you can do with your friends. There's Belle Isle, which is the really pretty kind of like island area downtown where you can drive across the bridge, and there's a lot of parks there and stuff. We did an event there with the learning communities early on in my M1. I got to meet everyone and do like field games, which was really fun. So there's a lot of stuff to do. And I'm just a walk from the Eastern Market too, which is a great place to be outdoors on Saturday, to go around, buy a few groceries and this and that. So if you're ever like unsure about life in Detroit, life in the city, feel free to reach out to me or any other M1s. Come to the coffee chats and things and ask us about those kind of experiences, and we're happy to help you. If you want advice on where to live, feel free to reach out. It is kind of a daunting process to figure out, where is best for you, but there's always people around to help. So don't be afraid to like reach out and ask questions. But yeah, that's kind of like a brief overview of the city and what to do, what there is to do. And yeah, I hope to see you all soon. I'm going to pass it off now. I think we're going to go to the admissions committee
Hi, everybody. So my name is Abhinav Krishnan. I'm the Associate Director of Admissions. I guess to kind of begin, I'm a proud alum of this school. I'm a product of Detroit Public Schools as well. And not just a proud alum of the undergraduate campus, but also from our medical school as well. Before we get started, let me go ahead and introduce Dawn Yarjo. She's been phenomenal as being our moderator for today. So Dawn Yarjo has been in our admissions office for over, I believe, close to 30 years, Dawn. And she's truly fantastic. And so she's our supervisor for admissions, and she's going to be, in our presentation here today. Dawn, so I'm going to go ahead and forward it over to you to take over the first slide.
So the first slide that we have for you from the admissions office, and first of all, thank you all for joining us. For the class of 2025, our M1 class consists of 305 future warrior MDs. 51% of them were female, 49% were male. 30% were first generation college graduates. We're very proud of that. That's a very good number for us. We definitely recognize some of the challenges that first generation college students have when applying to medical school. We are a state funded school, and last year 175 of our students came from the state of Michigan. 130 of them came from out of state, and that was 22 different home states plus Canada. 175 of them, again, were from Michigan, and then we had a contingent, a large group from California, Illinois, Florida, Massachusetts, and Ohio. So kind of, the broad spectrum across the continent of the United States.
Great. Thank you so much, Dawn. So again, thank you all so much for joining us this evening and, sharing your time with us today. So, I'm just really excited that everybody's really here. So though we know that a lot of your pre-health advisors have regularly shared this information with you, for our prospective students, here's some information that you might find useful as you begin to curate your applications. So a completed application can be stratified into these categories that you see here. So starting with your secondary application, your personal statement, your academics, letters of recommendation, distance traveled, community service and activities, as well as healthcare experiences as well. The information that you list help to answer some of the questions that I've listed below each of these topic headings that you see here, and essentially distill all of those ideals to our admissions committee. And more specifically, it helps to clarify what your preparation really was for medical school, who you are, and more importantly, what was your journey to come here today. So we can move to the next slide. Great. So here, where we want to share some important dates with everybody as well. So our interviews at Wayne State occur between August through February of the following year, when we complete approximately 1,500 interviews. Now, per the AAMC, admissions offers can only be given to students beginning in October. Offers will continue to be given in this sort of rolling basis through the first week of July. And each year, we typically extend about 600 to 700 offers. Now, another important date that we'd like you all to remember is December 31st, which is our application deadline, which is coming up at the end of this month. So keep that in mind as well. Now, the last two dates that we'd like you to keep in mind are April of the following year. So this would be April 2022. In April, we host our second look day, and is also a time in which accepted students may only hold one acceptance per AAMC guidelines as well. And finally, in July, we begin our classes. So with that said, I'm going to transition over to Dr. Barbara Jones and Adam Zingerle, who's going to provide everybody some information about financial aid. Thank you all.
Thanks, Abby. My name's Adam Zingerle. I'm a financial aid advisor here at Wayne State. Barbara Jones is also financial aid advisor at Wayne State. The two of us are assigned specifically to the med school. Our office is in the Missouri building. We're part of a bigger office of financial aid. Total staff in the financial aid office for the whole university is about 35 people, and myself and Barbara are assigned specifically to med students. So if you have questions about the process, reach out to us directly through our contact page. We're available by phone, email, We have Calendly appointments available for, so we can call you back and answer all your questions. Just going to go briefly over the process. Wayne State has financial aid available primarily through the FAFSA. If you've done this in the undergrad, it's the same process as you did as a freshman, sophomore, junior, senior. It's something that you would do every year, as main requirement is being a U.S. citizen or permanent resident. You can do the application now all through the next year. You can do the FAFSA application for the upcoming year. The financial aid office will receive it, and we start processing those applications and send out award letters electronically, usually in April, March of 2022 in this case. If we do not require parent information, that's a question that we get a lot. Some schools do require parent information. It's not something that we need for our FAFSA applications. Go to the next slide. This is a chart that is on our website that explains some of the way that we calculate our need-based financial aid. We call it a Board of Governors scholarship that ranges anywhere from $2,000 per year up to $18,000 based on information from each individual person's financial aid history. You can review this, and based on this is what we use to award the financial aid. In addition to the primary source of funding for students is the student loans. Federal student loans are available for everybody that's eligible for the FAFSA. And without going into too much detail on the process, student loans are available enough to cover the cost of attendance, which is tuition plus living expenses for each academic year. So in general, that's an overview of the financial aid process. Please reach out to myself or Dr. Jones, Barbara Jones, via our contact page, and we'll be able to answer any questions that you have and make the process as easy as possible. With that, I'll turn it back over to Laura, and thanks for your time.
Hi, everyone, and thank you so much for joining us. And Adam, thank you for the introduction. My name is Laura Samuelson. I'm the Enrollment Management Coordinator in Enrollment Management for the School of Medicine. With all things financial aid, financial wellness is also a big piece of that. So on that same track, as Enrollment Management Coordinator, I meet with all of the admitted students for the new incoming class, and we have specialized meetings. So we talk about your current financial situation and how that will impact your transition and success in medical school. It's really all individualized. You can kind of see these small screenshots. You're not meant to really get all of the content from the screenshots, but just know that for each of you, we have a specific plan and we will meet individually and go over that together. Things like how to budget your refund, understanding satisfactory academic progress. We have educational modules for financial wellness, really anything that you need to succeed. And if you're ever feeling overwhelmed financially or otherwise, enrollment management is here for you. I've provided an email address and a website, and my meeting link is also going to be provided to you through the admissions marketing and communication plan. So a lot of opportunities to contact me, and I look forward to meeting with those of you who are already admitted, and hopefully those of you who are still deciding and end up with us for the start of your med school career. Thank you so much. And I'm going to pass it back to Dean Schweitzer for questions.
Dr. Latanya Riddle-Jones is available. She is the co-director of service learning. She's an assistant professor in the Department of Internal Medicine, the Division of Internal Medicine and Pediatrics. And she is going to be able to talk to you a lot more succinctly than I did about service learning. Dr. Riddle-Jones?
Yes, good evening. Happy to join you all. I hope you can hear me well. I'm Dr. Riddle-Jones, and not only am I faculty at Wayne State School of Medicine, I'm also a graduate of the School of Medicine. I'm not going to mention what year because it was a while ago, but my picture is on the wall down on the first floor of Scott Hall. And it's an honor to be able to work with the students and the trainees, the residency program, the internal medicine and med peds residents. And so I just wanted to mention that there's some great information that's been shared with you all tonight. But one thing that's really important for you all to know is how committed we are to service. Here at the School of Medicine, not only do we have a lot of student organizations that engage with the community, but it's a part of the requirements of the curriculum. So service learning, you have to get at least 35 hours of specific clinical outreach and mentoring hours in your first year of medical school. And then that continues in the second year of medical school. We also have community engagement elective, which is something that you can take if you want a more in-depth community engagement experience with local organizations and agencies that serve the people that we take care of as physicians and future physicians. So I did want to at least get a chance to speak to all of you about that tonight. If you have more questions, please get in touch with us, and I can answer more questions on a one-on-one basis. But part of the reason why I came to Wayne, so I went to Michigan State for undergrad, got into a few medical schools in the state of Michigan and a few outside. But once I got that admission letter from Wayne State, knowing the reputation, having mentors who look like me here at the school, like Dr. Silas Norman, who passed away a few years ago, it just meant the world for me to come back and to serve my community and to get the clinical experience that's offered at Wayne State, which is unlike any other clinical experience that you'll get at any other medical school in the country. So good luck to all of you, and I hope to see you soon in the fall. Thank you.
Thank you, Dr. Riddle-Jones. This is going to wrap it up for this evening, although we will have a few minutes. We will stay on here for a couple of, answering any last minute questions. But I want to thank you. As you can see from, this group of alumni that were here, they all care very deeply. I frequently get asked the questions about, why have you stayed in the admissions office at Wayne State for almost 30 years? It's because I love interacting with the students. I get a lot of joy from it. Right now, I'm seeing a lot of children of the students that I interacted with, 20 years ago applying to medical school. So I find that very enjoyable. But I do wish you all the best. We will post this on our YouTube channel. Our next event is coming up on December 7th. It's one of our coffee chats. And you can find any of those on the admissions website, admissions.med.wayne.edu, and just look for events. We have a lot of things. I just looked over there recently, a lot of our previous activities. So if you guys have some time, you got winter break coming up, go ahead and binge watch some of our YouTube videos. You'll find out a lot from our students, and we appreciate everyone being here.